Officer at Animal Emergency and Referral Center of Minnesota. And today I am joined by Dr. Briana Keller. How are you doing today, Dr. Keller?
I'm doing well. How are you?
I'm great. Thank you. Beautiful day today.
Yeah.
And today we're going to be talking about cancer in pets and different treatment options. So if you are currently facing this dilemma with your pet, you're going to want to stay tuned. And certainly if you have questions for Dr. Keller as we're going, pop those in the comments and we'll make sure to get to those. Um, Dr. Keller is our board certified veterinary oncologist, one of two that we have at Animal Emergency and Referral Center of Minnesota. And I know there are a lot of cancer treatment options for pets these days. Is that right, Dr. Keller?
Yes. Yep. It can vary greatly based on where your pet's cancer is, what kind of cancer, what your goals are. But yes, we have a variety of different options to help your pet live their best life, even with cancer.
Fantastic. So we're going to jump into the different options and kind of go from most common treatment options to less common ones. And let's start with the one that probably everybody is familiar with, which is chemotherapy.
Yeah, I think people often almost have like a knee-jerk reaction when you hear that word because it can be really scary. And, unfortunately, a lot of people have human loved ones that might have undergone chemo. And in general, people can have a really hard time with it. And one of the biggest differences in when we give chemo to animals is that our goals are often different because chemo drugs in general, I think of them, they're toxic drugs that kill cells, and that's what cancer is, but they're, mutated abnormal cells we want to kill, and most chemo drugs can't only target those. So we see side effects because they target cells in your intestinal tract, so they can cause GI upset. They target healthy stem cells where your blood cells are made, so it can like increase risk for infection or bruising. But in humans, we're a bit more tolerant of those side effects. But one of the biggest differences is humans get to consent to that treatment. They get to
Sure.
understand why they're going through that, and it's their choice. And so, when we give these drugs to animals, it's not their choice. And so for us, quality of life has to be the primary goal. So the doses we use in animals are often a bit lower or less intense than what we give to people because, again, it's not them deciding whether or not they want to undergo that. And so we have to make sure that they feel well during these treatments. So
Okay.
it's really focused on what treatment, what dose, what protocol is going to give your pet the best quality of life. We of course want to make them live as long as possible too, but never at the expense of how they're feeling.
Right. And so with pets, um, is the focus more on giving us more time rather than necessarily curing what's going on with them?
Right. And it's not that we never cure cancer in animals. It's not terribly common, but it's mostly because, again, if our goal given chemo was to cure them, we would be making them horribly sick. And even in
Okay.
humans, like often there's not a guarantee that if you undergo this really rigorous treatment, you're going to get cured. They can give you
Right.
statistics and you have this percent chance of a cure. But again, you can understand that as a person and you can decide that, yep, I'm willing to feel sick for this amount of time if it means I've got a better chance to, see my kids grow up or, live to this date or whatnot. So,
Right.
so there are some cancers we can cure, but again, never at the expense of we never want to make patients feel awful on the way to trying to get there. So,
Okay.
my favorite phrases I've ever heard about describing what we do when we treat cancer in animals is we give them more good days. Like
Okay.
that's our goal.
Okay, great. And so we just want to kind of um, put it out there that chemo doesn't have to be this horrible thing for your pet. A lot of your patients behave normally, live their normal lives,
Mhm.
don't really even seem to know they're getting chemotherapy. Is that right?
Right. And that's the goal. And honestly, one of our favorite things about the patients that we get to see regularly is we love when their owners send us photos of them doing things they love, like going for hikes, going on the pontoon ride with at the family cabin, and just seeing photos of them doing all the things they used to love before their diagnosis and get to continue to love for, again, more good days. So yes, the goal for them is that they should not be acting sick. And while chemo does have the potential for side effects, just like in people. It can make them nauseous or not want to eat great, or it can again increase risk for things like infection. We
Mhm.
try very hard. If those side effects do happen, we'll modify the treatment the next time. So we want to work as a team with pet owners, so that way, they tell us if that dose was too much for them, if they didn't feel good on it. So, we want to work together to try to, again, make sure your pet's quality of life is as good as it possibly can when it can be, when they're on chemo.
Okay, fantastic. So then let's move on to the next modality. And I know this one is probably less familiar to people, electrochemotherapy. Can you tell us what that involves?
Yes, yep. So normally with chemotherapy, we think of these as systemic treatments. There's both IV and oral chemo options depending on the drug and what cancer we're treating. But normally, again, we use chemo for, kind of dosing cancer that's throughout the body, either a blood cancer or cancer that's spread to multiple places. But with electrochemotherapy, it's actually a way to kind of hone and make chemo targeted just to one specific site. So during this procedure, while an animal's under just a quick period of general anesthesia, we'll inject them with an IV, an intravenous chemotherapy drug, so it gets right into their bloodstream. And then shortly after that injection, we have a machine that has a topical probe that would be applied directly to the scar or the tumor that we're treating. And each time we touch it to that patient's skin, it delivers a topical electrical pulse, almost like a mini shock, if you will. And what that allows any tissue to do is, if there are cancer cells in the field we're treating, they can open up where they take up the chemo drug in circulation at a much higher rate than what is being distributed throughout the body. So again, normally chemo is used for cancer throughout the body. Sometimes we'll use it for like a solid tumor, but this is a case where we can really kind of hone it right to that site. So we'll use it either for, cancers like a skin cancer that's been removed, but we didn't get all those microscopic cells that we're worried could grow back, or sometimes really tiny tumors that are just not in a great location to have surgery, like on the nose. We can use it for those. So yeah, it's a way to, again, kind of make chemo a more localized therapy.
Got it. And this is a series of treatments that pets undergo, and they're under anesthesia, right?
Mhm.
So they don't feel anything while this is happening.
Yes. Yep. So the main reason they're under anesthesia is it's pretty uncomfortable to get those topical electrical pulses there. So we don't want them to be feeling any of that. We want them nice and sleepy for that, so they don't feel any discomfort.
Okay.
And then it's usually 2 treatments done roughly 1 month apart. There can be a little bit of skin irritation that happens, and so we wait for that to heal from the first time to do the second one.
Okay, fantastic. So that's another good option for folks. And then um, let's go on to surgery, because I know that surgical removal of tumors is often kind of the first line of defense against cancer.
Yeah, yep. So for a lot of like what we call solid tumors, like it's a mass on the skin or an internal mass you might not be able to see without imaging.
Mhm.
Our surgeons, we work very closely with them for a lot of our cancer patients. And so, we'll often consult with them. Sometimes when patients are here for an oncology visit, we'll be able to have one of our surgeons take a look at them when they're in hospital just for their oncology workup, or if we're doing additional tests. And so they can help gauge, what surgical option that patient might have. For any solid tumor, I'm sure everyone's familiar with that tip of the iceberg analogy, and that's true for a lot of cancerous tumors as well, meaning the part of the mass we can see either externally or on like an X-ray. There's almost always microscopic cells below the surface. We can't
Okay.
see them, we can't detect them. And so what our surgeons are always going to be assessing is, can they get a wide margin around the tumor? So if anyone's ever heard the term like margins in relation to cancer, we're trying to basically get a nice buffer zone between the edge of the visible or detectable tumor and the edge of what we can remove. So if anyone listening has ever had a pet with a cancerous tumor, you might have noticed that the skin incision after surgery was a lot longer than the tumor was wide. And
Right.
that's because, your vet would have tried to take a nice margin around it so that they could get all those microscopic cells that again, would have the potential to grow back or maybe even spread to other sites if we don't get them. And again, sometimes that's not possible. Tumors that form in tricky locations like down the leg, there's just not a lot of extra skin there. So that's where we can use things like electrochemotherapy afterwards. But yes, anyway, our surgeons are really, really helpful for us in treating a lot of those solid tumors, internal or external ones.
Absolutely. Yeah, my dog Sally had a mast cell tumor, and she saw your colleague, Dr. Keatman, and one of our surgeons removed her mast cell tumor. But to your point, it was in sort of her armpit area,
Mm-hmm.
and it was difficult to get really good margins there. So then she proceeded with electrochemotherapy, and knock on wood, she's doing great. So.
Yay. Yeah.
And
Yeah.
then let's talk about radiation. So that's not an option that we currently have at AERC, right?
Correct. We do not. But sorry, I can see my golden in the background
Yes.
there. But
Hi, Lilo.
yeah. But we work closely with some facilities in the Midwest that do, so we can always send, both my colleague and I have enough knowledge of radiation to often know what cases are going to be candidates for it, and we can at least chat with owners a little bit about what to expect to see if that is even something owners feel like is going to be, a valid option for their pets, or just
Sure.
if they think their pet would do well with it. And then if so, we facilitate getting the referral and records sent to the facility that they end up choosing to go to. So that's an option as well. But yes, we just don't have it at AERC.
Okay, great. So people could come to you, get that consultation, find out their options, and if radiation is the path that they want to take, you can refer them elsewhere.
Yes, yep,
Okay.
exactly.
Fantastic. And then let's talk for a minute about advanced imaging, because I know that comes into play a lot with cancer diagnosis and ongoing monitoring of the situation, right?
Yes, yep. So another service we work very closely with in our hospital is our radiology department, and we use them a few different ways. One is that often the cancer might be internal, like if it's a lung tumor, that's nothing we're going to be able to see externally, or a tumor in the abdomen, so sometimes we use them to even help like diagnose the tumor. Another way we'll often use our radiology department is for what we call staging. Many cancers, depending on the type and other factors, do have the potential to metastasize where they travel to other organs. So even if it is a tumor on the skin, if it's one that we know spreads to the lungs or spreads to the liver, we'll use our radiology department to image those sites so that they can help us determine if there is evidence of cancer spread. And sometimes they can't tell just by looking at it. And so in those settings, sometimes they'll, get a tiny little, what we call a fine needle aspirate. It's a small needle, no bigger than the kind for a blood draw that we might use to get a sample of like the spleen if there's something in there that they can't tell for sure what it is. And then one of the last reasons that we'll use the radiology team is if there is a visible internal tumor, so not externally, that we are trying to treat with chemotherapy, or we're just monitoring for development of metastasis later on, we'll often repeat those tests to monitor a response to treatment. Like if a pet has metastatic cancer internally, and we're going to try chemotherapy to see if we can shrink any masses and prolong that pet's quality of life, how we have to know if it's working is by repeating those imaging tests if there's nothing we can see externally. So our radiology team is great at, they'll kind of measure masses and let us know if they think it's progressive or stable or, improved. So they help guide our treatment decisions as well.
Okay, fantastic. And then let's talk for a minute about, I know that you are certified in hospice and palliative care in pets. And I know that's a large part of your job too. Sometimes I think pet owners think, well, there's no point in seeing an oncologist because I'm not planning on pursuing treatment. But that's not always the case, because you can help them in other ways, right?
Right. Yep. And yes, that is, not true at all, that if you're not if you don't think you won't pursue additional treatment, that there's no point. And, I will say a lot of our primary care vets are fantastic at palliative care management too. So I never fault anyone if they don't want to come talk to an oncologist, but, it is something that we're always, more than happy to just kind of go over what to expect, since obviously this is our specialty. We treat a lot of dogs and cats with cancer. And there are some, palliative care options that that might not be something that your primary care vet is familiar with because they don't do it all the time. So yes, palliative care really just means making sure your pet is as comfortable as possible. And one of the things I like to mention is that it's not completely, mutually exclusive with treating your pet's cancer, because I want to make sure your pet is comfortable, even if we are doing chemo, even if they have, surgery. So palliative care is a part of the cancer treatment plan from day one. It's just, what else are we adding in? And sometimes we don't add anything else in. It's just palliative care. And so that really just means what medications, what treatments, what therapies are going to just help your pet be comfortable, even though we're not doing anything that's going to actually slow the cancer progression. We are just going to try and, prolong how, the time before your pet's really affected by that cancer. So many times that does involve pain medication. One of the most common cancers we see is bone cancer in dogs, and that's very, very painful. And so we are really aggressive at getting those pets on appropriate oral pain management. Sometimes there's even IV drugs we can give for that. Sometimes it's just treating the symptoms. So for instance, if a dog or cat has lung cancer, they might be coughing, and if it's enough that they're keeping themselves up or their owner's awake because they're coughing so much, we can add in cough suppressants. If animals are vomiting due to their cancer, if it's something in one of their abdominal organs, we can prescribe anti-nausea medications. So there's a lot of things we can do. I never call it doing nothing if owners decide that, they're not going to pursue chemo or radiation or surgery, because,
Right.
Doing nothing would mean you're not even giving your pet medications to make them comfortable, in which case I think that's really sad, but it's not doing nothing if that's what you're doing. And again, a lot of our primary care vets are really great at that too, but I also have quite a few patients that have come to see me. They've chosen the palliative care route, and they continue to see me for nothing else other than just to make sure that, having someone else check in and make sure that there isn't anything else that pet needs for their quality of life. So it's, sometimes when you get to see your pet every single day, it's actually harder to notice those subtle signs. They might be more painful or not feeling great. So having someone like me, or again, your primary care vet that only gets to see your pet every 1 to 2 months for kind of these palliative care checkups, I call them, then, sometimes it's actually easier because we've got a wider time point between when we've seen your pet.
Right. So you're able to kind of notice those either improvements or declines more than
Mhm.
than an owner who's seeing them every day.
Yeah, yep, because it can happen so gradually that, until you look back in hindsight, then, it's can be harder to pick up when it's not a night and day decline that they might show.
Okay. And then let's talk about immunotherapy.
Yeah,
Um, I
yeah.
know that that's kind of a newer option for pet owners. Is that right?
Yes, or and even in humans, it's a little bit newer. And so immunotherapy really just means, what is there anything that can be done to train your immune system to help attack the cancer cells? Like chemo, surgery, even radiation, those are all external things we're doing, but immunotherapy is there anything we can do to help stimulate your immune system? And there's really only one that's officially labeled for animals. It's for dogs with oral melanoma. Melanoma, people might be familiar with because we get it in our skin if you spend too much time outside. Dogs, it doesn't have that relationship to sun, but it also, unfortunately, like in humans, can be really aggressive in the mouth. And so there's a vaccine that's designed to help train a dog's immune system to attack its own melanoma cells. And so that's an option for that cancer. Some of the main limitations with immunotherapy are that it's often not a universal thing, meaning, that vaccine, it's only for dogs that have melanoma. It also, unfortunately, can't prevent melanoma, so we don't give it for prevention, but, it's not something you could use for a cancer like lymphoma, which is a cancer of a white blood cell, versus a lot of chemo drugs. Not all chemo drugs will work for all cancers, but there's a lot more double dipping where chemo drugs work for multiple different cancer types.
Sure.
The immunotherapy is very specific. And one of the other downsides is, for chemotherapy, most of our drugs are actually that we give to animals. They're human drugs that we've adapted for animals and figured out what dose we can give an animal, which is, again, often lower than a person. But immunotherapy, there's not a whole lot of drugs for human immunotherapy cancer treatment that can translate to animals, because these are often species specific things that they're trying to stimulate, or that the drug is unique to like the human gene for that, immunotherapy marker. And so just because something immunotherapy wise works for a human with that cancer, unfortunately does not often translate that it's going to work for a dog or cat with that same cancer type. I do know there's a lot of kind of investigational studies happening with other forms of immunotherapy, like ones for bone cancer. There's some trials looking at that. So we're trying to come up with some stuff, but really the only one on the market right now officially is the oral melanoma vaccine.
Okay, got it. So if that's something your pet has been diagnosed with, certainly an option, but
Mhm.
beyond that specific type of cancer, you're not going to be able to use immunotherapy as a treatment.
Not often. Yeah, there's like a couple that maybe by the time, if any of you listening have a pet that's diagnosed, maybe by the time you end up coming to see us, we might have something. Because yeah, there are some investigational things, but as far as something being offered as a like this has been proven in studies and something that we really strongly recommend or offer, there's not unfortunately that many options for animals for immunotherapy.
Okay. And then lastly, let's talk about of end of life care, because obviously, that's probably a large part of what you do. And um, what does the oncology service offer for pets
Yeah.
where that time has come and owners are facing that difficult decision?
Yeah. So a lot of my clients that are even if they're at the point where we're just doing palliative care because their pet stopped responding to treatment or they declined those things to begin with. Something else that no vet loves having to bring it up, but we also have a duty to if we feel like an animal's suffering and if we know we don't have any treatments or medications left that are going to help, sometimes we'll bring it up. But a lot of times owners know too, and I know, we try very hard as well to kind of prepare owners from the beginning of if it is a cancer that we know is going to be terminal, we want owners to know what to expect even from the time of diagnosis. We don't want it to be a surprise. It's
Sure.
not going to make it any less sad. We know it's heartbreaking no matter what, but we at least don't want it to be a surprise if we can. We can't always predict it, but we try to help owners know what to expect. And
Okay.
so, when we get to those palliative care chats, if we feel like that pet is really painful, they're not eating well, and they're already on every possible medication we could try for those things, we'll have that discussion. And so, most animals with cancer, and kind of regardless of the type, they don't usually just die on their own at home, which, I always tell owners the nice thing is that owners are very unlikely for most cancers to ever just have a horrible shock coming home from work one day and your pet is gone. It's of
Sure.
course not a for sure thing, but that's very rare.
Yeah.
The trade-off is of course it usually falls on owners to have to make that decision for them because most cancers unfortunately make pets and humans for that matter feel sick for a while before they actually pass. And so since we do not have the option of human hospice care where you can be like in home in a hospital bed on like an IV really high dose painkiller. That's how we can ease suffering in humans. We just can't do that in animals. And so
Yeah.
that's where humane euthanasia comes in. And that is a service that we offer through the oncology service. So we do have some clients that want to come back to us, especially, it's from any different treatment plan the pet has had before. But I think many of our patients that have been coming to see us for many months or even a year or more, they bond with us, they bond with our nurses, and it sounds odd to say, but it's actually quite an honor when clients want to come to us for that because
Right.
it means we've showed them that we love their pets just as much as they do. Well,
Yeah.
as much as close to as much as we
Right.
can. Um, for clients that it's becoming I think more and more popular for people to want to have pets pass at home,
Mhm.
and so we don't do that directly ourselves, but we refer clients to some of the many in-home euthanasia practices that the Twin Cities has. We're kind of lucky that there's quite a few.
Mhm.
For clients that live outside the Twin Cities, we at least refer them to the ones in the cities because they might know of some ones that come to your home, and sometimes primary care vets will as well.
Right.
That's just a little, it can be a little bit logistically difficult just for a clinic setting to do that. So I always direct clients back to their primary vet to see if just that's something they're able to do. Not all are,
Right.
but yeah, some of them just prefer to have them pass at home too. And then some primary care vets have really good relationships with the clients too, especially if you've had this animal as a puppy or a kitten, and your primary care vet, I'm sure, bonds to them as well. They love your pet too, and so there's there's many different options for, where and who,
Yeah.
can be done with that. So the most important part we always want all clients to know is like we make it as peaceful and it is a painless thing for them. It's probably the worst part of being a pet owner is when you have to make that decision. But again, most of the time at the end stage, animals are suffering, and this is the kindest, most selfless way we can relieve their suffering. And, when I had to make that decision for my own dog, I kind of viewed it as I'm taking on this immense emotional, heartbreaking pain so that she didn't have to feel physical pain ever again. So it's really a selfless thing.
Yes, it is. That's a lovely way to put it. I really appreciate that viewpoint. Additionally, I should mention that AERC hosts a monthly support group for owners who are facing pet loss, and as well as there's a private Facebook pet loss group that we have that you can find by going to our main page and then clicking on groups. If you are either facing the loss of your pet and maybe you're in that anticipatory stage, or if you've already lost a pet and are looking for support, those are two great options for you as well. And there are a lot of other pet loss support groups around the Twin Cities too for folks. Thank you so much for talking with me today, Dr. Keller.
Yeah.
I'm sure that hopefully but your work is so important and so appreciated, and your bedside manner is just fantastic. And I know that when I think of somebody who was born to do veterinary oncology, I'm just like, Dr. Keller, this is just her calling, because you're so kind and you're so wonderful with your clients and patients. And I so appreciate the work that you do. Thank you for chatting with me today.
Oh, thank you so much. You guys have a good rest of your day.
Yeah, thank you.